Hello, Tanaka. In Africa, we endeavor to cover the whole of Africa and beyond. Our mission is to strengthen lab compliance, and we offer end-to-end management systems consultancy, starting from gap analysis, taking labs all the way to accreditation. And our services are summarized here. We offer ISO standards training, mainly 17025 and 15189. We offer accreditation mentorship, gap analysis audits, risk management training, and root cause determination, including root cause analysis training as well. So for today's webinar, these are the learning objectives. We're hoping that by the end of this session, you will be able to distinguish between corrections, corrective actions, and opportunities for improvement. We're also hoping to impart you with knowledge to identify, utilizing risk assessments, data analysis, and feedback mechanisms to proactively identify opportunities for improvement. We're also hoping that by the end of this webinar, you'll be able to prioritize through applying tools like impact effort matrix to select the most valuable improvement project that you'll then implement. And we're hoping that you'll get some insights into implementing quality improvement projects using the PDCA cycle to ensure sustainable results. So some people would call it a PDSA or PDCA, plan, do, check, and act, or plan, do, study, and act. And in today's webinar, we will cover 5 sections. The first section will look at the context, that is the standard that we are implementing as medical laboratories, ISO 15189 of 2022, and talk a bit about the shift in mindset that comes with ISO 15189 2022. Section 2 will then talk about identification of opportunities for improvement, and we are introducing to you 6 possible sources of identification of opportunities for improvement. We will then look at prioritizing and selecting opportunities for improvement and picking them for quality improvement projects. We will then look at how you implement quality improvement projects using the PDCA methodology. Finally, we'll look at some examples of real-world case studies and common pitfalls that most labs come across as they implement quality improvement projects. So now going into section 1, we know that recently the world adopted ISO 15189 2022 version of the standard, which was coming in after we had a 2012 version that lasted us for a good 10 years. And we are very much aware that most of the lab personnel that are currently working in the labs are so used to 2012 version. And the majority of the people that we are dealing with nowadays, they were introduced to quality when 2012 was already in place. But we do have a good number of people that started with 15189 at inception when it was first introduced in 2003. We then had the standard evolving. 2007 version after 5 years was revised and introduced. Again, after 5 years, 2012 version was introduced as well. So the 2012 version is the only one that lasted for 10 years. And people literally have their DNA, the QMS DNA based on 2012. So having implemented that standard for 10 years, there is a major shift that came with 2022. One of the critical clauses that we saw in 2012 was preventive action. And in 2022, that clause was dropped. And why is this so? Because the entire standard, the 2020-22 version, is now built on risk-based thinking. So everything you do as you implement quality management systems based on 2022, it's a requirement that you approach it with a risk-based thinking approach. Therefore, you do not need a separate preventive action clause because everything you are doing is now risk-based. And emphasis on the 2022 version is on clause 5.6 and 8.5, which we'll review shortly. Clause 8.5 talks about risks and opportunities for improvement. And it talks about actions to address risks and opportunities for improvement. So you will see that throughout the standard, a number of times the standard mentions risks. The opportunities is also tied closely to risk. But however, it doesn't mean that opportunities will only come from the risk. We will be looking at this later and identifying other sources of opportunities for improvement. But according to 8.5, 15189, 2022, the lab must identify risks and opportunities to prevent or reduce undesired impact, to achieve improvement by acting on those opportunities, and to assure the management system achieves its intended results. And the key takeaway we are seeing from this is that opportunities for improvement are not just a nice to have, but these are formal requirements of the quality management system. Without identifying opportunities for improvement, you are only partially fulfilling the requirements of the standard. And most labs fall short when it comes to identification of opportunities for improvement. Focus mainly when it gets to 8.5, most labs will focus on risks and they will forget to implement opportunities for improvement. Hence the webinar today. Then moving on from 8.5, the standard introduces improvement under clause 8.6, 8.61, which is focusing on continual improvement. The lab shall continually improve the effectiveness of its management system through the use of the following quality policy and objectives, audit results, analysis of data, corrective actions, and management review. So once you've identified your opportunities from clause 5.6, you've acted on those. Under 8.5, now the requirement is that you continually improve. And this is through implementing quality improvement projects, the QIPs. And this again is the major reason why today we have a webinar focusing on improvement. And it is important to remember as scientists that improvement is not a destination. In other words, when you get to accredited, it is not the destination. It is just the beginning. Improvement is an ongoing cycle that requires continuous measuring, analyzing data, and acting on the results of the data analysis. Now, the engine, like I said earlier, of continual improvement based on ISO 15189-2022 is the risk-based thinking. In the past, the labs would wait until there's a problem, a non-conformity is raised, then processes will be fixed based on the problems or the errors that the lab is now encountering. But 2022 says, let's rewire everything. Let's take the risk-based approach and get everything flipped. Before things go wrong, you identify what can potentially go wrong. Once you've done so, you assess the impact and the probability, and then you create an opportunity for improvement that you will then investigate further and see how you can improve that and implement a quality improvement project. So improvement in this sense happens before the patient is harmed. You don't have to wait until things go wrong. You are trying to prevent harm to the patient, and the focus is on patient safety. Could I please launch the poll? We want to check from the people attending today, what's your lab's improvement maturity level? Having said that, do you consider yourselves as mostly reactive? You wait until there's a problem and then you respond, or you consider yourself somewhat proactive or systematically proactive, meaning you have systems in place, you are systematically identifying risks and opportunities and acting on them before problems appear, or you consider yourselves at the highest level, excellence culture, where everyone is very much aware of what is happening and they are proactively identifying problems and acting on them systematically before the patient is harmed. So I do see some responses. We have 31 respondents so far, 32, more are still coming. More are still coming, 39, thank you for the responses, 42. More are still coming. Okay, one more. Then you share the results, Kuda. Okay. All right. So from the poll, colleagues, thank you so much for the responses. We had 45, 69% of you participating, and 18% say it's still mostly reactive. 47% somewhat proactive, 33% systematically proactive, and 2% say excellence culture. And congratulations to the 2% that have made it insofar as continual improvement is concerned. But we do have a majority falling between somewhat proactive and systematically proactive. We are in our third year of implementing ISO 15189 based on the 2022 version. And this is very encouraging because we see labs now moving towards the proactive approach. So the risk-based thinking, the labs are adopting it. And that exactly explains why you are in this webinar, because you are proactive and you want to continually improve your labs. But we do have 18% that are probably here to learn and see how they will be able to implement in their labs and ensure continual improvement. Thank you so much. We will stop sharing for now and continue with our presentation. Okay, so section 2, now we're moving towards identification of opportunities for improvement, OFIs. And we are introducing some sources, possible sources. It's not an exhaustive list, but we are introducing some possible sources of opportunities for improvement. But before we get there, we need to define a few things here. Very common terms that are used in quality management systems, but we need to identify and define those terms. The first one is correction. The definition is an immediate fix to a problem. You have a problem and you are doing a quick fix. And what normally triggers this is an incident that occurs. And the example is recalibrating an instrument after a failed QC. You walk in the morning, you run your QCs, and chemistry QCs are failing. Bilirubin is failing. And what you do, you calibrate the bilirubin, and that is a typical example of a correction, a quick fix that you are putting in place in response to an incident of a QC that has failed. Okay? And then there's corrective action, which has been preached to us over and over again if we are implementing quality management system. And the approach with this one is that you are trying to eliminate the root cause to prevent recurrence in future, okay? And what triggers this is a non-conformity that the lab has identified, has documented. You gather as a team to identify what the root cause is, and then you come up with corrective action, which you monitor for effectiveness to ensure that the problem does not recur in future. And this example we can give there is changing your maintenance schedule because calibration appears to be failing on a weekly basis. So now there is a non-conformity there. And the quality management team is approaching this with the NC approach with thorough root cause analysis. And they are saying, we need to document this and check for effectiveness. And then we are introducing today the opportunities for improvement. Here, we are saying things are being put in place to enhance performance or to reduce risk. This is before things go bad, right? So this is triggered by your risk assessments or trends in the data that you are monitoring as a lab. And you are saying you want to optimize systems before things go bad, before your patients get harmed. An example we can give there is automating a manual entry process to reduce TAT by 10%. TAT is not failing. We are okay. We are meeting the minimum requirement, but we see an opportunity there by automating the manual entry process so that we speed up the process and perform even better and reduce it by 10%. That's an opportunity there, okay? An opportunity for improvement is a process that works but can be optimized, while a non-conformity is a breach of a procedure. You have a procedure in place and you are not meeting the requirement that is in the procedure. For example, a high TAT variability, the example we gave earlier on, your TAT is varying a lot, is an opportunity for improvement. As long as the TAT, you've not surpassed the set TAT. But a wrong patient label is a non-conformity and it has to be addressed as such, okay? And then consider the scenarios. The first one being a new analyzer that could reduce reagent costs by 20% is an opportunity for improvement, okay? So there's no non-conformity involved there, but you are running a lab and you know that it's a business and you want to reduce the costs. And if you've identified a new analyzer that comes in cheaper and you want to reduce the cost by 20%, that's an opportunity for improvement there. While proficiency testing that is failing is a non-conformity that need to be addressed as such, okay? But in general, the moment you walk into a lab and you hear people talking like, that's just how we've always done things, it means you found an opportunity for improvement there. You have people working in the lab, they are so used to their system and they are defending the system. Whatever suggestion you are putting across, they will tell you that's how we've always been doing things, okay? And it's working for us. But you are coming in and saying to them, let's optimize things and improve, despite the fact that you are still meeting your minimum requirement, okay? And understanding the difference between opportunities for improvement and non-conformities is crucial for effective quality management. OFIs are opportunities for proactive improvement, while NCs require immediate corrective action with thorough root cause determination. Okay? Now, going into the sources, I said earlier on, whenever you see risks, there's in the standard, there's also mention of opportunities for improvement, and the standard tends to marry these two. So definitely you'll find a source of an opportunity there under risk assessments. And in the last webinar we had in November, we talked at length about risk management. And I'm sure by now we are all clear with what a risk management entails, okay? So as an example, for a source of an OFI and a risk assessment and the pre-examination phase, unclear handwriting on manual request forms leading to data entry errors. I'm sure we all know the handwriting of a physician, of a doctor, and the form comes through written nicely by a doctor, but because of the unclear handwriting, the people that are using that information to capture patient data are likely to make errors, okay? And then in such a case, you probably have an error rate of around 0.5%, which is low. It's a low risk, but you are coming in with an approach to say you want to make every patient matter. 0.5% represents a life, and you are saying you want to improve and optimize your system, and you then identify an opportunity for improvement there by introducing and implementing an electronic order form that allows the doctors to go into the system, capture the patient details, and that way the errors will be reduced, okay? And the benefit from this is that you are eliminating those handwriting errors completely and you are avoiding the risk, okay? Still under risk assessments, but this time under post-examination risk, critical results are not communicated if phone lines are down. So you are using your telephone lines to communicate critical results to clinicians and physicians. But then you realize that when the phone lines are down, such communications cut. Therefore, it means the patient will not get the required treatment in time. An opportunity there is to introduce and implement an automated SMS alert system for clinicians to immediately receive critical results as soon as they are reported. Apologies there for the noise. I hope you can still hear me loud and clear. Another example is report interpretation confusion by GPs. At times you're sending out a plain report to the clinicians and they may not be able to interpret your results properly. So you introduce interpretative comments or a traffic light coloring in your patient reports to ensure that when they see a red, they know that there's a problem here, they need to act fast. When they see a green, they know that the results are good, they are within expected normal ranges. So those are examples of opportunities for improvement that you identify through risk assessments, okay? Source number 2 is now a data-driven approach where you are mandated by the standard under clause 8.8.2 to monitor quality indicators. So you have listed a number of quality indicators as a lab, and you are monitoring those quality indicators. For example, in the pre-analytical, you have a percentage of hemolyzed samples. This is looking at the phlebotomists, how good they are with their phlebotomy skills. You are monitoring the percentage of hemolyzed samples percentage of mislabeled tubes, or incorrect order types. Under the analytical phase, you are looking at CV trends or proficiency testing scores. If you are participating in PT, and in post-analytical phase, you are looking at turnaround time, how fast you are giving out the results, and you are also checking the corrected reports rate, critical value reporting as well. So these are examples of how you can use data to identify opportunities for improvement. But those numbers normally don't make sense. You want to visualize improvement by plotting the numbers of the indicators so that you are able to identify trends before they actually go out of the set limits, okay? So it's always good that when we are monitoring indicators, you need to put them in a way that you'll be able to visualize. This helps you to spot any shifts and any trends before they actually go out of your set limits, okay? And then source number 3, this is about user feedback, and this is addressed under clause 8.6.2. And we are saying you should not just wait for complaints, your clients to come back to you and complain about things that are not in place, but you should proactively seek feedback from your clients. This could be your clinicians or your patients. So normally you have a suggestion box that is running. You have a dedicated client services line. You will also have a time where you run user surveys, be it your clinicians or your patients, and then you sit down, analyze the data, and see if there are any trends in terms of issues that are raised by your clients so that you address them in advance. Another way of getting opportunities for improvement is through staff suggestions. And here the Japanese came up with the Gemba concept in which the lab management team or whatever organization management team goes to the site to where things are happening. You are maybe identifying your phlebotomy area, for instance, as an area for your Gemba moment for the week. You go in there, you talk to the people, identify how they are carrying out the process, identify, talk to them and understand what problems they are facing, understand how systems can be improved. And I'm telling you, as top management, you get a lot of feedback from the people that are actually involved in the process. So this can be a very good example of identifying opportunities for improvement. As you do so, you are capturing these down, you are documenting them, and you are providing that as evidence that you are implementing opportunities for improvement as required by the standard. Source number 5 is through your internal audits, and we are saying auditors should be trained to add value to systems. They should not just be looking out for non-conformities. They should also identify observations and add value to the system. For example, an auditor notices that while the temperature log is filled out correctly, in other words, you are compliant, you are also meeting the requirements, the set targets, but because of the thermometer being inbuilt in the freezer, there is some frost buildup there. An auditor can highlight that and highlight an opportunity for improvement there, which would require you to replace it with a digital probe with an external display that improves the accuracy and ease of reading of temperature. So that's an opportunity there that you identify through internal audits. Just one example. And then source number 6, which we are also proposing, And this is the last of the list, but like I said earlier on, it's not an exhaustive. There's many areas where you can identify opportunities for improvement. Task number 6 is about external assessments, and we are saying let's learn from the best. Proficiency testing, you are comparing yourself with the rest of the world, and you are saying how and where am I sitting compared to the rest of the world? I may be passing, but sitting on the lower end, or I may be passing, sitting on the higher end. Okay, so you're looking at that data and you are saying, let's read closer into the data and identify opportunities for improvement by looking at the trends. Some opportunities can come from accreditation bodies that visit your lab. You look at the assessor comments. For instance, an accreditation board may send assessors, they send you a recommendation report, of course, highlighting the number of non-conformities that you need to address, but there's normally a section where your assessors will give you recommendations for improvement. Make use of that data and identify opportunities for improvement. Okay, so moving on, you've identified your opportunities. How then do you decide which ones will be implemented as fully fledged quality improvement projects? And we are saying you need to use the improvement funnel approach, okay? You take all the identified areas, ideas in terms of opportunities for improvement, which you are likely to identify on a daily or weekly basis. But because you don't have resources to implement everything, you then ask yourself, does this align with the quality objectives that we've set as a lab? And then you also use a filter by looking at the impact and the effort, and then you select projects, having looked at all those things. Okay, so now looking at the impact versus effort matrix. This is a very critical tool that you need to consider uh, for identifying which ones can be used for quality improvement projects. Okay, so looking at this one, to the left, you have the impacts. You're looking at an item and you're saying this is low impact. If we implement this, it will be low impact versus going up, the higher impact. And then you look at the effort, how much resources will I need to implement this? You're starting from the low, going to the high end as well. So as you look at this, you want to start off with your quick wins, where you are getting the highest impact with the little effort in terms of time, in terms of resources. So those are the ones you will then filter down and say, I'm going with those ones first, and those need to be done first, okay? And then next, you look at the major projects, those with the highest impact, with the highest effort. You need to look at them carefully and plan to do this. Maybe you may plan to say, okay, in the next financial year, we'll budget properly for this and include them in our activities because they have high impact, but we may not possibly have resources immediately available at that point, okay? And then you have also these we call fill-ins, those with a low impact and low effect effort. These ones you can consider to do them if time allows. If you don't have time, if you don't have resources, rather not do them at all, okay? And then the thankless tasks, these are low impact with high effort. These ones are just there to drain your resources. Please avoid them at all costs. Don't do them because they will drain your resources, but will have little impact, okay? Now, as quality practitioners, you'll also realize that quality involves money. And when resources are involved, you need to motivate top management that you want to implement this particular project, but management will only listen to you if you are putting $1 to it, okay? So your argument should be driven by what you are going to make or what you are going to save in terms of dollars to the organization, okay? So the cost of poor quality, we can divide this into tangible costs and intangible costs, okay? Tangible costs being the cost of reagents that are wasted through reruns. So as you argue your way out, you say, we want to implement this project because we've realized we are wasting a lot of reagents and we have to rerun, blah, 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 blah. And you are putting numbers to it to say the reruns are costing us this much, okay? And as we do so, we also realize that we have to pay overtime for the manual work that we're doing. Therefore, we are proposing an automated system. This will reduce overtime paid to staff over time. We'll be making a lot of savings from that, okay? And then the intangible costs, as you argue your way out, you need to highlight that if we don't improve this, patients will be dissatisfied, we'll be losing out on patients, and over time, we'll lose out on the numbers. So in short, I'm saying we need to highlight the costs that are attached to poor quality so that we can justify implementing the quality improvement project, okay? Moving on to section 4, now we're introducing implementing the projects. And we are talking about the PDCA cycle, which is commonly called as the Deming cycle. And some, those who've gone through IHI approach will call it the Plan, Do, Study, and Act, or PDSA cycle. It's one and the same thing. It was introduced by the Japanese several years ago, and it remains the gold standard for quality improvement. So the plan is about analyzing the root cause, and the do is testing a proposed solution, and the checking or the studying is measuring the results, and acting is standardizing the results or the methods, okay? Briefly, we talk about root cause analysis. This, I think, has been talked over and over. If you're a quality practitioner, you know about this, the Ichika diagram and the 5 whys, and normally they are used in combination, okay? And then the do is the pilot testing. You need to think big, but start small, in small cycles, and implement your PDCA cycle. Don't roll out a massive change to the entire lab overnight. You will not be able to manage it, and you will not be able to tell if there's any improvement or not, okay? All right, so for instance, you have a scenario we are giving here as a pilot. You are implementing a new phlebotomy labels because you are realizing that your samples are coming in unlabeled properly, and you test this in one department or a ward if you are working in a hospital setup for 1 week, okay? And you are monitoring that and understand what could be the problem and whether that is working in that area or not, okay? You don't want to disrupt activities across the whole hospital. You want to focus on one area where you will be able to monitor closely the change that you are implementing, okay? Now, as you do so, you're also moving on to the check phase in the PDCA cycle. What we are checking for here is whether or not the change actually resulted in an improvement, okay? So you'll have taken your baseline, identify what the baseline data is, and then you're comparing that against your pilot data to see if there is any improvement in the metrics that you are monitoring, okay? As you do so, you may see an improvement. Before you draw your conclusions, you also need to do a sanity check to say, okay, there is an improvement that we are seeing here, but did that improvement not introduce a problem elsewhere? That's a sanity check that you need to be doing before you celebrate and scale up the improvement. Okay, so you need also do a sanity check. Okay, and then as much as you can, try to use statistical tools to verify the significance, because in most cases you may see changes in numbers which may not really mean a thing. Okay, you need to test statistically and prove that indeed the change you are seeing is a statistically significant change that you can really that is worth celebrating. Okay, all right. And then once that has been done, you need to act by standardizing and sustaining the improvement that you've achieved. Okay, and that also takes you to revising the SOPs, the job aids, and the policies to reflect the new process based on the results that you would have achieved. And once you've done so, you would need to train your staff on the new SOP, ensuring that you retain your training records to be able to fulfill the requirements for clause 6.2. You need to monitor the change that you've introduced through KPIs for 3 to 6 months to ensure that this improvement that you've introduced actually stays and it becomes part of the culture of the team. Okay, once you've done this, you need to take time and celebrate the success of the team. It's always good to acknowledge that the team did something good and you celebrate the wins. Okay, so public recognition reinforces a culture of improvement and motivates staff to report new opportunities for improvement as and when they identify them. Okay, so as you do so, you need to highlight the team's contributions. It's not just the quality manager, it's not a team lead that needs to celebrate the improvement, but acknowledge that it is a team effort. Okay, communicate the before and after results, hospital-wide, if you are working within a hospital, to show that indeed the team participated. Now we've improved our TAT from such and such a percentage to such and such a percentage, so that the whole hospital acknowledges that you guys are doing a great job. If you have some publication of some sort, a newsletter, it's also good to take pictures and post and write a short abstract to celebrate your improvement. Okay, so if you are an organized country and you are organizing conferences annually, it's also good to present your data at a conference so that you keep your team motivated. Okay, so now we'll look at some examples. Case study number 1 is reducing hemolysis. You've identified that there's a problem, certain tubes coming from a certain department, hemolyzed, and the hemolysis rate is around 6%. You see an opportunity there, and you identify that the cause is that the nurses are using small gauge needles for fast draws because it's an emergency situation. They tend to use those ones. They are comfortable with those, especially the older nurses. Okay. Now, as an action, you introduce the Vicutena needles plus nurse education. You provide sessions for nurses and provide the tools for them to use. And the result that you are getting over a period of 3 months is a reduction from 6% to 1.5%. Because this is an activity that involves a department outside the lab, there is need to share your results and celebrate with the nurses in that particular department, like I said earlier on. Okay. And then case study number 2 about critical value reporting for critical value TAT. The problem is that the average time to call a critical potassium result was around 45 minutes, and yet the target is less than 15 minutes. Okay. The opportunity for improvement there, rather the cause, is that the lab tech had to look up the doctor's phone number in a paper directory, and probably it's a very thick directory that you have to go through and search for a number, and it takes a lot of time. Okay. Now, the action that you'll be introducing there is integrating the doctor's directory into the LIS so that the number pops on the screen automatically. Okay, so as soon as you capture a critical result, it pops up and show you that this is critical, you need to call Dr. Soren. So that's an improvement that you are introducing there. Okay, and then you see that that opportunity then reduces the waiting time for calling out critical potassium results from 45 minutes down to 8 minutes, because then I don't have to stop and look for a paper directory, search for the number, and call that doctor. So that's an improvement that you can implement there. Okay. So as you do so, we're highlighting some common pitfalls for implementing quality improvement projects. The first one being trying to fix everything at once. It never works. Okay. So that's why we are saying start small, but think big. Okay. Think big, but start small. And be systematic in your approach and stay focused. Okay. Number 2 is lack of data to support your claims. Okay. So making changes based on a feeling rather than evidence. You need to do baseline data analysis and be objective, because now you have data and you are implementing projects that you can compare to say, we started off at this point and this is where we are. It's more than just a feeling, but it's data driven. Okay. Number 3 is ignoring stuff. That is implementing changes from top down without asking bench staff. We talked about the Jamba moment there, and we said we encourage teams, top management, to go down to the level where activities are being carried out. You talk to your staff, identify opportunities through that approach, and then you'll be able to implement. There's going to be buy-in, because you are not ignoring stuff that are involved. Okay. And then the last one is failure to standardize. Improvement works for a month and then slides back because SOPs were not updated or people were not trained on the changes that were made. So it's something that is sitting in the quality office or the lab manager or the lab director's office, but has not been standardized across all areas. So the idea of implementing quality improvement projects is that when you identify something that works, you don't just celebrate it has worked, but you celebrate and standardize and ensure that it is applied across all activities. And now here are some key takeaways as we wrap up. Number 1 is mindset shifts, which we see being introduced by ISO 15189-2022, which encourages us to move away from fixing errors, but taking a risk-based approach to improvement. Okay. Number 2, use of your data. Your quality improvement activities should be data-driven. So making use of quality indicators and feedback are the best sources of opportunities for improvement, okay? And once you've identified many opportunities for improvement, find a way or use some tools to prioritize these for implementing quality improvement projects, and the high impact and low effort projects should be implemented first to build momentum, because you're putting little effort, but you are getting highest impact from there, which is evident, and everyone is seeing that indeed the project you are implementing has brought about some impact, okay? And then finally, you need to follow the PDCA cycle. You need to follow the PDSA cycle. The Japanese introduced this a long time ago, and it's been used across all industries. It's been proven to work. So let's make use of tools that are proven to work. Okay. So this brings me to the end of my presentation. But before we open up for questions, maybe let's just go through the last few slides. Here I have a QR code. If you are using a computer and a phone, you may scan this. This will take you to a link to be able to get you a certificate of participation, okay? So we have 10 questions that will kindly ask you to go through, very easy ones, and you are expected to achieve 90% and above to get a certificate. And I'll also share the link for this. If you cannot scan the QR code, I'll share the link on the chat box so that you go through the questions to be able to get yourself a certificate. Okay. And then finally, as CLISS QA training services, this webinar is available as a full training that lasts 2 days. It's called Continual Improvements, Mastering the Identification of Opportunities for Improvement and Implementing Quality Improvement Projects. And we have 6 or 7 modules. We're looking at the improvement mandate as one module, the art of identification of OFIs, data-driven prioritization is another module, QIP methodology, where we go at length on how you implement quality improvement projects. We also look at measurement, monitoring, and evaluation, and also integrating these with your management review processes. So that's one training we are offering as a 2-day training. We also have an ISO 15189-2022 bootcamp. This is a 5-day training where we look at understanding the requirements of ISO 15189-2022. On day 2, we look at documentation and process requirements. And then day 3, we look at implementation and expand on continual improvement. We also then move on to internal auditing planning. And day 5, we look at execution and reporting of internal auditing. So after 5 days, you will be able to fully understand the requirements, document, implement, and be able to audit an ISO 15189-2022 based management system. We also offer a training on risk management. This runs through the requirements from theory to a lot of hands-on practice. And by the end of 2 days, you'll be able to fully implement and understand risk management processes based on ISO 22367 and ISO 15189-2022. Again, it's a 2-day course that has 8 modules. We're looking at context and policy, risk planning, hazard identification workshop. This is a hands-on workshop for identification. And then we look at risk estimation, risk evaluation and acceptability, risk control, residual risk and benefit analysis, monitoring, and continual improvement. So you see, continual improvement is applicable across all the activities. Then we also have a one-day full program, one full day program for management of non-conforming work. And this, we look at detection of non-conforming work and documentation, containment and risk mitigation, advanced root cause analysis, where we look at different tools. We also look at CAPA, review, audit, and continual improvement. So these are some of the training activities that we are currently running, and we are saying they are delivered through an in-house approach. You invite us to your organization. We do a hands-on training to your team, and we can also offer the training virtually through interactive sessions with live lectures like we're doing here, case studies, and collaborative group work for maximum engagement. Okay, so you can get in touch with us. If you are able to scan the QR, you scan the QR and get in touch with us, or you send us an email. Our email address is info@CLISSqualityadvisory.com, or you can send us a WhatsApp to this number, +267, it's a Botswana code, 76540-559. And we do have a Facebook page. You search for CLISS Quality Advisory. That's where we post most of our activities, and that's where we send information about webinars that we are running and any trainings that are currently on offer. We also have a LinkedIn page, CLISS Quality Advisory, Pty Limited. That's where we also share information about any trainings or any activities that we are conducting. You are free to follow us on those socials, and you'll be able to get more information regarding the services that we offer. Okay, so this must be my last slide. Yes. So let me quickly share with you on the chat box the link to the short quiz that will lead you to getting a certificate. So I'm stopping sharing. I'm sharing the link on the chat box. Thank you so much. Any questions? Am I talking to somebody?
Yes.
Yes, Sanulo.
Yes, Mr. Mjongwa.
Thank you so much. Any questions? I'm going through the chat because I couldn't go through the chat as I was